This episode is brought to you by our sponsor, the American Academy of Orthokeratology and Myopia Control, which is currently introducing its new base membership. What is base membership? Well, it's the AAOMC's new free introductory membership type, designed to help educate doctors on myopia control and orthokeratology. Whether you are brand new, an experienced fitter searching for pearls, or someone who's dabbled in the past and ready to step up their game, AAOMC base membership can help, and it's free. So what do you have to lose? Go to orthokacademy.com, click on the practitioner button, and join us. Join the war against the myopia epidemic. Today on the podcast, I have with me Dr. Caroline Kaufman, who the reason why we have her on the Corrected View is because recently the AAOMC sent out one of its initial newsletters, and Caroline wrote an interesting article for that newsletter called Conducting a Myopia Management Evaluation During a Pandemic. And I thought, why not invite Caroline to come onto the podcast and go into more depth about what that entails, what a myopia management evaluation looks like in the era of the pandemic, and maybe we can get some pearls and interesting information and tie back to the article. So Caroline, welcome to the podcast.
Thank you.
So first, let's start things off. Just give us a brief introduction about yourself, where you practice, how you got into myopia control and ortho-K.
So I practice in Bellevue, Washington, and I kind of started dabbling in ortho-K probably 20 years ago, but really got more seriously into it probably 7 or 8 years ago, just sort of due to, kind of market demands in my area and my patient population. So I really kind of got very into it after going to my first Vision by Design meeting, actually. And my background is I did a residency in cornea and contact lenses at Pennsylvania College of Optometry. I guess it's now called Salus University.
Awesome. Yeah. Awesome. Well, thank you for joining us. And just to get things started off, let's talk about the basics of the article and why you wanted to write it.
So I wanted to write it because I thought that, the telemedicine is something optometry has historically shied away from, but there are some definite applications during the pandemic to implement it. I mean, it may not have a lot of uses, but it definitely seems helpful for a consultation. And in fact, it's something I'll probably continue to use even after the pandemic has resolved.
Okay, so why do you think typically in the past optometry has been cautious about using telemedicine?
Well, I mean, it definitely has its limitations, right? Because we want to be able to use our biomicroscopes and, have face-to-face interactions with patients. And we worry about what we might be missing if we're not able to, get a, very magnified view of, say, the cornea, for example. But, there are certain things where, for example, just the conversational piece of the myopia management consultation, that piece can go on for quite a while. Sometimes parents have quite a number of questions, and I like to show charts and graphs and things, and so that part can go on for half hour, sometimes 45 minutes, and that's a lot of face-to-face interaction, especially wearing a mask, especially if it's the first time the patient's meeting you, and then now they're not even seeing your whole face. So I really think that telemedicine is a great tool for that portion, because then you can still have all of those interactions, but with no mask, and maybe the parent who was at work and wasn't able to join, everyone that is interested can be on the screen and hearing the conversation.
Yeah, I mean, imagine I imagine in the pandemic, it's got to be difficult enough, right? All the steps you need to take in a standard optometry practice, but when it comes to ortho K, when it comes to myopia control, that's a patient that requires a lot more of attention. There's a lot more staff interaction. There's a lot more interaction with you. There's more follow-up visits. So it's just, that's why I wanted to have you on to talk about what steps are you taking in your office compared to, what steps are you taking in your office with the pandemic in general, and then what extra steps are you having to take to do a myopia management evaluation?
Yeah, so I imagine every area of the country is a little bit different in terms of, where you're at about exactly what you're doing for dealing with the pandemic. Um, Washington has been pretty conservative about how we're dealing with it. So we are still taking every precaution, wiping off every surface. Masks are required for both staff and patients. We're limiting the number of people in the door, very much social distancing everyone that comes in. I actually have a instant messenger on my exam room computers where I just push a button and ask if it's okay to bring the patient out front. That was something I never had to worry about before, but now I actually basically ask permission to bring the patient out of the room
Hmm.
before I bring them out. And so that was a new thing. Exam times are longer just to deal with the additional cleaning. Um, and we've done things to minimize in chair time. So have very efficient technician who is better at image captures than I am for topography and pentacam. Um, I'll help her out with lid holding, but she does all of the running of the machines. Um, and so we just kind of have it pretty well dialed down to efficiency and trying to get people in and out quickly. But then by having the consultation where I'm actually speaking about what I think might be good for the child, that piece being done remotely allows us to really take our time, be more relaxed, having already gathered all of the data, and then we can, really get into depth without worrying about, boy, this is taking too long, and I'm worried about the amount of, contact I'm having with these people.
Gotcha. So how has myopia management then changed? I mean, we mentioned it earlier with telemedicine and having that be now a component where, whereas before maybe one parent brings the child in and you talk about, what's how things are progressing or that initial consultation, and now with the telemedicine approach, you can get more of the family involved, more people involved. But as you were saying, those are longer conversations. So how has myopia control or myopia management changed as a result of the pandemic then?
Um, so if you mean logistically, we have the patient come in with just one parent initially. Um, and so depending on if they've been referred in by an outside doctor and have already had their annual exam, I've already looked over the records, I've figured out what steps I need to take. Um, and so sometimes it'll just be a bare minimum of we take topographies, we, gather, I'll take a look at the corneas and have a brief conversation with the patient about their, if I think they may be a good candidate for, a soft multifocal lens or a ortho K lens, about their willingness, and whether or not they're afraid of the idea of contact lenses. So we kind of start that conversation a little bit, just so I can see how on board they are with this idea. But yeah, I do a lot more pre-planning. So I plan ahead of time what I need to do with each individual patient, depending on whether they've already had a comprehensive exam elsewhere or with me, or if they still need one, and kind of, have very methodical steps lined out about what we need to do. And then, we've taken the images, and then we set up a separate appointment, sometimes just later that day, maybe last appointment of the day, so that I'm not going to be in a rush. where we, get on, I get on my laptop and share my screen and go over um, all of the findings and the recommendations and answer all of their questions.
Okay, so based on what you said before about using telemedicine in the future, even after the pandemic, what role will telemedicine play in the future of myopia control? Like, what potential does it have, or have we seen the limitations of it?
So I think that it definitely has the potential for the continued use of um, the consultation piece to be able to include other family members or parents that may not have been able to make it to the initial evaluation. So I think that would be great. So maybe in the future, for me, it would be optional to schedule that piece separately if there's a parent that wants to be involved but isn't able to make it in for the initial consultation or the initial data gathering. But what would really be great in the future is if there was some way to be able to do, the biomicroscope piece, the topographer piece, like if that was something that could happen at home, if they could get their own images, then I think that there could be a much bigger role for telemedicine. But absent of that, I think it's really important to be able to look under the slit lamp and take the topographies at each visit. So that is one limitation of completely eliminating the in-office visits for the follow-up care.
That's an interesting idea of getting the images from the patient. I mean, there's so many different tools and things that people have even on their phones. Like, I wonder
Right.
what that would look like as far as the quality of the images and interacting. I mean, obviously that's going to take more time, and it makes me
Yeah.
wonder if you would have an invested person in your staff. Like when I talked with Dwight Barnes, he mentioned that he has like a myopia control coordinator, a staff member specifically devoted towards myopia control in his practice. And it makes me wonder if that staff member could be, an essential role in a practice and kind of help with the heavy lifting so that's not all falling on, the doctor. And what would that look like? So it's an interesting like vision into the future about
Yeah,
what
for
that might
sure.
entail.
Well, and I have my technician is working on her NCLE, so she could certainly play a bigger role in the future once she has that additional training. Who knows what the future will hold with that, but maybe she even brings a portable slit lamp and, we do have a portable topographer already. So I don't know,
Oh,
maybe
interesting.
for certain patients, in-home visits, I don't know. There's,
Yeah, that kind of harkens back to that, that old romanticized idea of the doctor, the old country doctor who comes to your
right.
home, right? So I
Yeah,
wonder, yeah, that's very interesting. Like
yeah,
if you can control that environment essentially, so that there's minimal risk, a portable topographer is. I'm glad you brought that up. That's very interesting. So
yeah.
yeah, I wonder. Yeah, that's a very interesting idea for sure.
hmm
All right. So I just have one more question then. And I mean, obviously, ortho-K and myopia management can be very intimidating in general, um, even without the added stresses of what's going on now with the pandemic. What do you have any advice for doctors who are looking to bring ortho-K and myopia control to their practice? With the state of the economy and with the way things are, this is often an opportunity for an optometrist to really reinvent themselves and be like, you know what, maybe I should give this whole myopia management ortho-K thing a fair shake. And you had mentioned earlier that, years ago you had started out by dabbling. And so what can somebody do to take this, to take a more vested interest in what you do?
Right. Great. Good question. Um, so first of all, I think that this is going to become so much more important, especially as we see that, like the state of Washington, for example, they just announced in the last couple of days that our school districts are going to all be online starting in the fall. And so, and given how conservative we've been with our approach to the pandemic, I don't see any end to this anytime
Mm-hmm.
soon. So
Mm-hmm.
these kids are going to be online and with much more screen time than they've ever had. So I can only imagine, how much worse the myopia is going to get, probably much more quickly. So it really becomes, a really important thing to really give some thought to, not just because of, the added income to your practice, but actually the service that you're giving to these patients that are likely to, we're going to probably see a spike in myopia. Um, so um, one thing that, I frankly wish I had gone to vision by design earlier. I mean, I'm not sure exactly when it started, but I definitely made some mistakes early on in terms of not having good, paperwork and agreements and kind of, communication with the patients and parents about what to expect. That's a really important piece to get in place even before you start dabbling, is to, really have that really needs to be nailed down. So no matter what you do before you get started, definitely thinking about, not only letting them know the expectations for this year, but what to expect for next year and how often will they be coming in for visits and what is the price of ongoing care subject to change. So that's a really important piece. And then, getting some really good training about exactly how to manage ortho-K, because things can certainly go sideways if you're not sure how to handle things. And if one common mistake can be just to not even start with great images to begin with. So really learning how to get great images initially, from your topographer is a really important piece. And that it's not rocket science. It's just important to know, how do you tell if you've got good images, and how to capture those good images. So that also is a really important piece. And then a third thing I'd say is important is getting some really good training on whatever lens or lenses of choice you're planning to fit. Have someone to mentor you, whether it's another doctor or if it's a really good lab consultant. But yeah, it's important to get some good feedback, especially when you're new to fitting ortho-K. And there are a lot of really good, helpful people that can help out with that. And for people that are already, fitting ortho-K but want to do more, one way to really help eliminate chair time is to kind of progress on to using software designed lenses, because that can definitely eliminate some chair time on your fitting appointment.
So we're talking about Wave and Ortho Tool and like that, software
That
like
kind of
that.
thing. Yeah.
Mm-hmm. Okay.
Yeah. So yeah, and then in terms of kind of the management of ortho-K, I think you could kind of speak to, where people can get that information. But joining the academy is very helpful, because then you'll be a part of a Google group, where you can ask questions, and even seeing some of the questions that come through and the answers that people are getting can also be extremely helpful. So even if you're just lurking on the Google group, you'll get a lot of really great information.
Yeah, for sure. The Google group, the Academy has a private members only communication forum that is a list serve. So somebody sends out an email and says, "Hey, I'm having trouble with this case," or "I have a question about this lens design." And the American group, the American Academy, is just one chapter of an overall international group, and we have everybody from all the different international groups in that forum. So when an email comes through and it just gets delivered right to your inbox, and then when people start responding in it, it continues in that thread. So you
Mm-hmm.
have like a globe's worth of experts and fitters and also people who are, in your shoes. If you're a new fitter, people who are just looking for information. So it's all different types of doctors with different, varying degrees of comfort and fitting levels and experience. And it's one thing I say when I meet, new Ortho-K fitters. I'm like, why aren't you posting more in the Google group? Because it's a great place to ask questions. I mean, I guess that can be kind of intimidating because you do have this, global effort of experts. But if you have a resource available to you, ask lots of questions, and that's definitely the place to do it. So I'm glad you brought that
Yeah,
up. Thank you.
totally agree. Hmm.
Excellent. And if anybody's interested in becoming a member, we just started a brand new base membership, which is normally our annual dues for standard members is $3.99 a year, and that comes with an assortment of great benefits like practice listings and you know uh, all sorts of great tools and resources. But we started a brand new base membership just to focus on the the initial education part. So that base membership gives you access to the Google group in addition to a video on demand library that we're creating where all sorts of members are creating presentations to help educate new doctors. So if you're interested in becoming a member and getting serious about Ortho-K, why not join the Academy? It's the introductory free base membership is the perfect way to start doing it. So, Caroline, is there anything else that you wanted to mention or about your article or anything else? Otherwise, where can people find more information about you on the internet if they want to get in touch?
Oh, yeah. So, well, actually, one other thing. So, for someone who's contemplating entering into Ortho-K that I just thought I would share, I just had a really satisfying encounter with a patient a couple weeks ago. He started Ortho-K with me when he was about 10 or 11. He was minus 450 with 2 diopters of SIL when he was 10 or 11. Um, so his parents decided for heading off to college, it was time to take him out of Ortho-K because they were afraid he wasn't going to be getting enough sleep and they didn't want to worry about that. So we took him out of Ortho-K at age 18, just over the summer here. And he's still pretty much that exact same prescription as he was when we started out when he was like 10 or 11. So
Excellent.
that was really satisfying, and he was thrilled. And of course, his parents weren't allowed in the room, so we didn't find out how thrilled they were, but I'm sure they were thrilled too. He drove himself to all the appointments. But anyway, so that was a really great kind of success story, kind of my first graduate of Ortho-K, if you will.
Nice.
Um, yeah, and so you can find me at factoriaiclinic.com, FACTORIA Clinic. And of course, there's a spot on there where you can contact us. So would love to chat with anybody, either on the phone or via email or whatever. But yeah, always happy to talk to people about how to get more involved.
Great. And thank you for your time. And
Oh yeah, thank you. Thanks for having me.
would love to have you back. I was thinking about doing a roundtable with various people we've had on the podcast to cover some essential topics that we've been getting questions about. And if you, the listener, have any questions about anything we've discussed here or on any of our podcasts, feel free to email us at thecorrectedview@gmail.com. And we also have an AAOMC Facebook. And if you're looking for more information about the Academy, that can be found at orthokacademy.com and just click on the practitioner button and you're there. So Caroline, thank you once again, and we'll be
Thank
glad to
you.
have you back soon.
All right. Thank you.